Let's talk lip filler. If you're looking for a little va-va-voom, you're tired of having dry lip, or maybe you just want a little plump, I'm here to answer all your questions about lip fillers. I'm Madelaine Caissie. I'm the owner and founder of Sparkle Lifestyle MediSpa, a medical aesthetic clinic in Moncton, New Brunswick. So the first thing you need to understand, what is dermal filler? So dermal filler is an injection of hyaluronic acid that we inject in your lip. Hyaluronic acid attracts moisture. It's something that your body produces naturally. So by attracting moisture, it gives your lip a little bit of a plump. Dermal filler, there's so many different types. There's some that are more designed to replace bone structure in your face that give you a little bit more volume, lifting. Then we have something that are more superficial that will give you more hydration if you're dehydrated and looking for maybe reduce a little creepiness around the mouth. The one that I'm talking about today is in your lip. So it's something that give a little structure to your lip and give a little bit of volume, but something that's really flexible and something that doesn't spread around when you talk. So really important that we use the right product in the right area. So who's a good candidate for this treatment? I would say most people, really. I mean, if you're really scared of needle or blood, or maybe this is not the treatment for you, we can look at other options. Hydration, plump, volume, structure, definitely a good treatment. If you do have an history of cold sore, we will give you a prescription of Valtrex before or after your treatment. It's really important that you take it. If you do have an active cold sore, we can't treat you. If you're allergic to bees, I usually don't recommend getting this treatment, because in case that we do have to reverse the dermal filler, we need to inject hyaluronidase, and people that are allergic to bees can't receive this product. So I don't recommend it to people that have a bee allergy. So what are the things that are really important for you to understand is that there's no lip that are the same. So the first step is really to book a consultation with a service provider and really make sure that they understand your goal, your need, your facial structure, because everybody's different and it's so important to use the right product for the right places so it doesn't migrate or you don't left with a really unnatural results. Here at Sparkle, the approach that we use is always to assess your face completely. Example, if you have a lack of volume in your cheek, or maybe you lost collagen with time, and then we start adding some dermal fillers in your mouth, it increases the risk of migration. You may not like what you get. So really important to assess the symmetry of your face, the quality of the skin and all that, to make sure that we give you the best recommendation to give you a natural looking lip. So the first thing that we look at is really your facial structure. But if we look at the lip individually, we need to make sure that the symmetry or the frame, the foundation of your lip is well done. So we would start with a product that may be a little bit more firmer, that gives you more structure, but then that can give the shape that you're looking for. Then we will add a little bit of volume if needed. So we may want to divide your treatment in two, right? Because we don't want to add too much at the time. I usually recommend starting with half a syringe, a full syringe max to your first appointment. Then after that first appointment, there's chances that you have a lot of swelling and the bruising risk is really high. So we need to make sure that's all gone before we inject again. So how your treatment is gonna feel like? I'm not going to lie, lip fillers are not always enjoyable. I've done a ton of fillers, ton of treatment, and I found that treatment quite pinchy. I can't say that it's hurt, it's really terrible. It's a pinch, it's uncomfortable. You're fully aware that you have a needle in your face, in your lip, but it's quite fast, usually half an hour and it's all done. We will start the treatment by numbing your lip. So at least that initial injection point is not as painful, but as we do the treatment, the more we inject, the more comfortable it gets. After the treatment, we'll leave you with a little ice pack. You can put it on about 10 minutes every hour to just keep the swelling down. really normal if you have some bruising. There's a lot of blood vessel, but something that we don't want to see though, it's an extreme bleeding, maybe a lot of purpura or like purple that goes around, or even like a whitening of your skin. That's not a good sign. If that ever happened to you, you need to reach out to your service provider. Dermal fillers in the lip can last as long as a year, even a year and a half, depending on what you're looking for. I'm gonna use me as an example. I'm not a big fan for myself to have a bigger lip. I have a really naturally super thin lip, and I have like that M-shaped lip. Structural done every 2 years, and I usually like to use a product that's more superficial, hydrating every year or so, especially around winter time, because I do have some dry lip and that really helps. But people that are looking for maybe that more va-va-voom looking, they might come back every 6 months or so to just top off their lip. I'm going to talk about dissolving lip filler. It's something that you need to take in consideration. The risk of migration is quite high. Definitely good technique, good product will reduce the risk of migration. Migration is when the product kind of goes outside of your lip. If this is the case, we strongly recommend to dissolve the filler and start all over. If you do have some migration happening, we do like to dissolve it completely, and then we will re-inject with PRP, and we can even do like a PRP gel. By doing the PRP injection, it's when we use your own blood, we spin it, we inject the plasma part of it. It will really help healing the tissue. It gives some strength to your tissue back, especially if there's migration there. We don't want just to re-inject so it migrates again. By doing the PRP gel, you do have that volume coming from the PRP gel, but you're not having the dermal filler. So we love using the PRP gel to improve the quality of your lips, especially if you had a lot of dermal filler done in the past. So a lot of the questions are, what happens if you stop having injection for lip fillers? The hyaluronic acid will just naturally fade away and your lip will just get back to normal. There's no sagginess or worse that can happen. At the exception that maybe you had a service provider that injected your lip way too much. After the swelling goes away, you may feel that there's a little bump here and there. That should go away completely. If you still feel bumpy after, make sure that you're coming back to your service provider. I hope this helped you understand a little bit better lip injection treatment. If you do have any questions, feel free to reach out and feel free to book your consultation with whatever service provider. Have a good day. Bye-bye.